Recording in progress.
Hi, Dr. Wen. Can you hear me?
Sam, yeah.
Hi.
Can you hear me?
Okay, I'm gonna have Donna comes up and then we're ready to go in about a second or two, okay?
Oh, okay. Do I have to share my slide or you guys can upload
Not
it?
yet. What we're gonna have Donna gonna come up and do her intro.
Yeah.
And then after that you will take over, okay?
Okay. All right.
I will bring it up right now.
Okay.
Hello, everyone, and thank you for joining us for today's webinar. My name is Donna Chow, and I'm your host and your moderator for today's eLotus webinar. eLotus is the leading provider of continuing education for acupuncturists. How many of you guys studied Shang Han Lun in school? If so, type yes into the chat room now. All right, so a few years ago, I learned that Shang Han Lun is no longer a required course, but an elective. Does anyone know if this is true? Let me know in the chat room. It is such an important text that I feel every herbalist should master. And today's webinar, Shang Han Lun Modern Applications, Part 3, presented by Dr. Huabing Wen. Before we begin, let's do a little housekeeping. Today's webinar will be from 1 to 5 p.m. Pacific time, and we will have 3 breaks. Lecture notes can be downloaded from today's course access page. If you want to join the chat, please set your chat preference right now to everyone so that we can all see your responses. For questions for our speaker, please type them into the question box in your Zoom control panel. Dr. Wen will answer the questions as time allows. And finally, the quiz and the video replay will both be available tomorrow, and you will receive an email notification when they are both ready. Our speaker, Dr. Huabing Wen, has been in private practice for over 20 years and is a master's program faculty member at both Yosan University of Traditional Chinese Medicine and Emperor's College of Oriental Medicine. He holds classes in TCM Oncology, Advanced Chinese Internal Medicine, and Chinese Classics at Emperor's well-known doctoral program. With his extensive knowledge of both TCM and conventional medicine, Dr. Wen provides the best possible care for his patients and treats a broad range of diseases in partnership with a wide range of health professionals. Dr. Wen has taught how to manage chemotherapy side effects and also Shang Han Lun with us in 2021. The CEU video recording is available now online at elotus.org, and I will post the link for you in the chat room in just a second. Okay, Dr. Wen, please take over now. Would you please share your PowerPoint?
Thank you, Donna. Thank you for the introduction. Let me. Okay, so everybody can see my screen. Okay, let's start from. Okay, welcome. This is
Dr. Wen?
Yeah.
The making full screen, you have the option on the bottom right. The little green on the right. Yeah, there. Got it. Just click on that. Yeah.
Okay.
Perfect. We got a full screen.
Oh, it's perfect. Yeah, full screen. Everybody can see. So first, thank you for attending this webinar. And this is the Shang Han Lun modern application, series, like a part 3. So we've been talking about quite a few formulas, and so my I've been teaching for quite some time. Some of you are my students, from the master program or the doctoral program. And I always try to figure out a way and how to use those formulas, classic formulas, mostly from Shang Han Lun, more effectively, more efficiently. Because if you ask, and most of the masters is like, okay, you have to go back to read the Shang Han Lun to memorize everything, and before you even start, to treat a patient. So that is a old-fashioned way of learning. So when it comes to 21st century, everybody says that. And so since we have Western medicine available, so how to combine those two, and so-called, it's a so-called integrative medicine. And it's a great way to help us understand what Shang Han Lun is about, and also make it, using Shang Han Lun formulas much easier. So there's so-called different school of thoughts, even within the Shang Han Lun field, and some are so-called very classic type. You can't even change the dose of a formula. You have to stick to the exact dose back then when Shang Han Lun, started. And so there's the other school of thoughts is like you can change things. You just you more use the approach of Shang Han Lun rather than stick to the original dose and the use. And so I'm from my training and everything, I'm more like the integrative medicine type. So basically, I try very hard to use from the integrative medicine perspective to explain what is that pattern is about, what is Taiyang being about, what is Yangming being, what is Shaoyang being, and under each disease, and there's the pattern. So what is that pattern? What is the modern interpretation of that pattern? Because I strongly believe if we can make that connection, or we understand from that angle, that will be much, much easier, to use the Shang Han Lun formulas, more effectively. So that's, and so the last class we talked about the Shaoyang syndrome, 小柴胡汤、柴胡加龙骨牡蛎汤、甘麦大枣汤, and the 桃核承气汤. And so this class will continue, but mostly focus on women's health and Shen issues. And so the formula will be covered: 桂枝加龙骨牡蛎汤、桂枝茯苓丸、当归芍药散 and the Wen Jing Tang. So, you probably already familiar with those formulas. You've probably been using those formulas in your practice. So what I'm going to talk about is how to look at from the integrative medicine perspective. So like, okay, what exactly that blood stagnation, what's the difference between the blood stagnation pattern we talk about in 桂枝茯苓丸 versus, 当归芍药散. So even though they both address blood stagnation, are those two blood stagnations the same or they're different? And also, like in 桂枝茯苓丸, we talk about, there's the fluid. There's the water retention, the fluid. That's why you use the fluid to help release the fluid. So will that be different from that of 当归芍药散? Because in 当归芍药散, you also address the water retention perspective. So those are the area I try to focus. It's like, okay, they're similar, they can be used together, but how to separate them. And the last formula will be discussed is Wen Jing Tang. So this is a most times people don't understand how to use Wen Jing Tang. I just give you one example, a recent case. And so she is the woman, she's 38, 39. And so she had 2 rounds of IVF. First round didn't even get pregnant. Second round got pregnant, but miscarried like week 7, week 8. Yeah. And so she herself had a very unique history because she had a head trauma like 7, 8 years ago. So constant tinnitus, ear ringing. So that was the reason, she started seeing me way back. And so she also has very strong, like almost like a allergic reaction to birth control pills. Because after the 2 rounds, the IVF treatment, so the doctor recommended maybe do a round of birth control pills and to prepare for the next round of IVF. So she said like, oh, that's too much. Yeah, so like just take a break. Yeah, so this is we started with that break. She also has a history of endometriosis. So I said, okay, so we forget about to get pregnant. We just focus on the endometriosis. So put her on Wen Jing Tang. Yeah. So first month, yeah, and so she said, oh, the PMS symptoms are very little now. Yeah, like a normal cycle, normal period. In the second round, she got pregnant. And so, went to see the doctors, like, oh, probably not pregnant. And so, long story short, so she came in last week. Yeah, so she's now 12 weeks pregnant. Yeah, so she was asking, okay, should I continue with the Wen Jing Tang? Like, okay, that helped. You should continue. Yeah. So this is one very recent case. It's nothing else but just Wen Jing Tang, to help, with the infertility. So there's, I'll talk more about that when it comes to Wen Jing Tang, how to use Wen Jing Tang, from which angle and what is the, the interpretation, from the integrative medicine perspective. Yeah. So a little bit of review, I've been talking about this all the time, the TSM and the conventional medicine, the focus is different. Yeah, in TSM, we pretty much, the 辩证 pattern identification oriented approach. So regardless of what eventually you're going to use to treat the patient, so you have to have that pattern identification, established. So this is like not, you try, you do this, you do that, but anything you do, you have to have explanation why you do it. So pattern identification is the most important part. So in conventional medicine, it's the disease oriented. So you have to have a diagnosis. Yeah. And without diagnosis, and it's just symptom management. It's not called treatment. Yeah. But those two are not always against each other. This is the integrative medicine is the way you put those two together. So I always use that analogy. It's like, okay, conventional medicine is pretty much you look a person from the front. Yeah, you can measure exactly, how big their eyes are, the distance between the eye to the mouth, and between the left shoulder to the right shoulder. So basically, it's measurable. The so-called evidence they need to see anything, measurable, detectable. And the Chinese TSM is more like you look at it from the back, because of the way they walk, a little bit funny. So you can see, they may have issues with their joint, with their bone, with their shoulder. Yeah. So to see a better picture, so if you put them together, you look at it from the front, very detailed description. You look at it from the back, so more function, like perspective evaluation. So you have a much, much better way, to basically understand what's going on. So that is regardless of what medicine we're talking about, it's if you can more accurate to evaluate, to assess, the pattern, the disease, the condition, what's going on. So the more comprehensive you can get, so the better off of the treatment. The better off, of course, the better off of the outcome. So that is something we need to be familiar with. So it's like, okay, Western medicine or conventional medicine is not our enemy. If we use the right, it can be our very good friend, help you, to better your practice. Yeah, that's why. I'll use one example, like the pattern we're talking about, pattern identification. So the integrative medicine pattern is the combo of from TSM perspective plus from conventional medicine. So TSM way, we know, we look at, from the symptoms, from the signs, and plus the tongue and the pulse. Yeah, and also, there's other, family history and medical history and history, treatment history. So you try to come up with that. And on top of that, if you add, lab works, if you add imaging tests, and so I'll use one actually to explain what exactly that means. So, but you have to have this idea. So the integrative pattern identification is more comprehensive, because you look at from both, conventional medicine and the TSM. So it's a combo. So here's the example, like blood stagnation syndrome. So we use that because in TSM, the formulas we're going to talk about today, Gui Fu Ling Wan and Gui Shao Yao San and Wen Jing Tang. So they all touch this. They all have this pattern, like blood stagnation. And so this is probably this pattern, like blood stagnation syndrome in the integrative medicine field, back in the 1950s, started from 1950s in China. And this is so far, I think, the most thorough, the most productive, in terms of like to explain, why so the Chinese medicine works. So it's like this is because you can explain that from the imaging test as well as from blood tests, and so basically it's like there's more like evidence there. It's not just like a patient, they feel better. No, that you have way more than that. And so from the TSM perspective, there's a trauma, if there's a mass, there's the pain, there's bleeding. So you see, then you have blood stagnation. And on top of that, the pulse and the tongue, you have a purple tongue, you have a choppy pulse, you have blood stagnation. And so on top of that, from the conventional medicine perspective, if you have what we call like a hyper coagulable states, the blood is too thick, the circulation too, too hot, temperature-wise, or too move too slow. And so you can see, that if that's the case, and you can just add that, even though sometimes, from TSM perspective, you don't see a clear, like a pain, like a big mass or trauma, they're like a noticeable trauma. You don't see that, but just by the change, they have those like hyper, coagulable states, but it's too thick. And you can look at, there's one way to check the fingernail bed, to see if those fingernail bed is you got too much twisted, engorged. So you can help each other actually by using those tests to detect, some of the blood stagnation in very early stage. So before even showing up, from TSM perspective, symptoms, signs, before that, you can detect that. So this is the beauty of the integrative model, because it works both ways. And so I'll use the example, also another example to illustrate how the integrative medicine model can help with the diagnosis, the pattern diagnosis. And we talk about the changes of the liver organ. Yeah, just this is literally the liver of the, Western medicine, liver. So if there's a change of the shape, of the liver, size, and the density or texture. So if the, this is like, okay, from TSM perspective, change of shape, decrease, the increase, you have a meaning, right? Yeah, if the size shrinks, that is a decrease, more likely yin deficiency, blood deficiency, sometimes, essence deficiency. If the size increases, that can be, two things. One is like an increased size, the size, but the density decrease. So it's like, okay, for example, like osteo process, right? Osteoporosis. The bone density reduces, but the size of the bone can be increased. So that is considered as a deficiency. What type of deficiency? Deficiency of qi, not able to control the size. Deficiency of the essence and the blood. So reduced density. So that is something, the principle, very, very new. You only see that in integrative medicine diagnosis. So this is not, like TCM, this is not conventional medicine. This is only the new concept only in the integrative medicine field. You see this. So that you can see the advantage of this. It's like, okay, so just you can put them together from the TCM perspective and the conventional medicine perspective, and you can come up very accurate, more accurate diagnosis. So the density, texture change, that also all means something different. So here is, I just used one of my patient recent MRI. This is one of very unique case. They have this patient. She's so far, I think, it's one of the longest liver transplant patient. When she was 2 years old, she had the liver transplant. So she's now 32. 32 now. So 30 years of liver transplant. And so recently, it's because there's some issues they're talking about, or maybe if you're familiar with the liver, pathology, anatomy, there's a portal vein. If that portal vein is being engorged, then it's being there's an issue. That could cause other problems. And so she sent me, she did bunch of tests. So she sent me this one MRI test. And I thought, oh, this is kind of like a very good way to illustrate what the integrative medicine look like in terms of the pattern differentiation. So the good news, look at, she herself, So there's 3 areas that they'll check, and it's liver stiffness. So if the liver is too stiff, too tight, because that basically, we're talking about when you have an issue with like blood stagnation, right? Because we know the chronic liver disease eventually turn into cirrhosis. So cirrhosis is, you can see, or at least you can see just like a bumpy, like on the surface, shrink, bumpy, more stiffness. That's considered as like blood stagnation. And there's the hepatic fat fraction. So it's basically like how much fat tissue in the liver, because I can measure that. It's like before you just say, oh, the liver, if there's a tumor, if there's something. So now they can do more. They can measure the liver fat fraction, percentage-wise. So the TSM thinking liver fat. What is liver fat? Phlegm, right? What type of phlegm? Can be turbid phlegm. Yeah. So a lot of people have problem with fatty liver disease nowadays. Yeah. There are two types, right? One is caused by alcohol. So it's alcohol. The other caused by, it's called non-alcohol fatty liver disease. We discussed that already from last class. Yeah. But you kind of like need to convert that. All right. So if patient come in, the fat like fractions increases, yeah, double or triple or just more, closer to the fatty liver disease, turbid phlegm. Yeah. So that is in the liver. So the last part, they do the liver iron concentration. So if this is a relationship we're talking about between liver and the blood. Liver, the TSM language, right? Liver stores blood. Yeah. So you may have liver blood deficiency or liver blood excess. So we have that concept, liver blood excess, but we don't know exactly, back then what that is. So now actually, if you have too much iron, yeah, and so that will be, yeah, too heavy, too much. That will be the excess of the liver, right? A lot of people have Wilson disease. It's like, they need to have issue with the copper, iron and copper, ratio, in the liver. So they need to literally every few months drain blood, right? To dilute that copper, the concentration. So make sure it won't be too toxic. Yeah. So those conditions are actually is what we call liver blood excess. Yeah. And so here is a basic, yeah. So the liver stiffness, yeah, and and there's also, when it comes to the liver, when the liver is inflamed, for example, if you have hepatitis, acute or chronic, and the first thing first, when the liver is inflamed, so the increased size, and so from those little liver cells to the the fat cells, so increased liver size from TSM perspective, right? Yeah, you could have one, liver qi stagnation, right? The qi is not moving smoothly. Yeah, qi also means increase the pressure, right? This is the early stage. So liver qi stagnation, so that can be measured. Yeah, if you can see, the size increases, because this is kind of like the natural development from conventional medicine perspective. So this, when they're inflamed, the size increases. Yeah. So all the other tissues, liver tissues, not being affected, try to compensate. Yeah, try to compensate, and so that's the qi stagnation. So what do we call liver qi stagnation? It's a functional issue. It's like a decreased function. So the liver is not as good function-wise as before. Yeah. So that is something, right? Yeah. And the other part of the inflammation can be due to toxin, due to damp heat, due to when you have viral, hepatic, hepatitis, yeah, like hepatitis due to like viral, different type, A, B, C, D, E. So that's, yeah. So now seems like they have more to come. Yeah. And so the liver, the stiffness we're talking about, yeah, the liver blood stagnation. So it depends on where, if you can see there's the fibrosis. So there's a liver blood stagnation, focused more like liver collateral. So this is the concept of liver collateral stagnation. Yeah. And so anything that can help to reduce that fibrosis. Yeah. And interesting enough, one of the formulas, we'll talk about, the Gui Shao Yao San, also can help with liver fibrosis. Yeah. So it's like, as long as you have the same pattern, you use the same treatment. Yeah. And the liver collateral, yeah, in TSM called the Luo Bing, right? The liver fat, yeah, quantification, like how much, yeah. So this is like we talk about. Remember we mentioned, the fatty liver, disease, turbid phlegm, turbid phlegm blocking the liver channel. So that's and the liver phlegm or turbid phlegm. So that's what we. Don't forget the high cholesterol. Is also can be put under this category. So you treat people coming in. Oh, they have high cholesterol. You can see that as part of the turbid phlegm blocking the liver. So can be liver organ, can be liver collateral, can be liver meridian, channel, based on whatever they have. So that you decide. And so the liver iron quantification. So we mentioned, that when you have the liver blood excess, that pattern. So this is so through this one test, MRI. So you can see how much information you can gather and how much that will help you to quantify your diagnosis of those liver patterns. Liver qi stagnation. Okay, so the enlarged, the size, liver blood stagnation, the shrinking, and the heavy, the increased, iron concentration, and liver phlegm, like okay, how much the fat, quantification, like increases. So this is what, I'm talking about. Like okay, we need to. This is just one example. The same principle applies to heart, lung, liver. Liver is included, and not liver, kidney, and other brain as well. So this is the approach. That's the principle you need to remember. And so the advantages of integrative medicine, like I pretty much mentioned, there's one, even from TCM perspective, sometimes like, besides one particular symptom, they have nothing else going on. So we just can't, pinpoint exactly which organ, which system. It doesn't matter what the pattern differentiation system you use. Zangfu, there seems like nothing else is relevant. And if that's the case, if you have blood work, if you have imaging tests, if you have some other, the lab work you can work on, that will help you a lot. So this is this is a little bit like a recap. What we need to do. The sensory organs, the other organs. Remember, the change of the shape, the size, texture, density. You kind of like have different combination. And also functional changes. Hyperactivity versus hypoactivity. So that is the two opposite perspective. It's hyper, mostly like yang, hypo, yang and the heat. Hypo, kind of like a yin and the cold. You have, decreased movement. That can be qi deficiency, not enough power to move, and also can be qi stagnation. So they move, but not as smooth, or like out of its rhythm. So that is called the qi, like stagnation. So, those are all clinical tips that how you use this, to put things together. And when it comes to treatment, the integrative medicine model, you always think from both angles, right? Try to increase the possible benefit, try to decrease the possible side effects. So that is a very important part. And so how to, practice that's just, takes some practice. And so let's get started with Shang Han Lun again. And we pretty much know, some of you haven't, I saw the, the chat box, some of you haven't, had Shang Han Lun or had very little. It's basically, it's 3 yang, 3 yin. Yeah, what is the Taiyang being? If you haven't had Shang Han Lun class, I strongly recommend you get started. Because this is if you want to be a great TSM practitioner, Shang Han Lun is a must-have skill. Period. There's no exceptions. So early stage of Taiyang being, Yangming being, we know the middle stage, Yangming being, Shaoyang being, we'll be talking about like last class, the whole class was about Shaoyang being. And Taiyin being basically the GI tract, digestive issues, and spleen and stomach. And one thing that spleen also include, from TSM, the spleen include pancreas. And so that gives you the idea, the relationship between pancreas and the spleen are very, very important, and pancreas and the liver, pancreas and the gallbladder. And from conventional medicine perspective, we know they're very close, right? But even from TSM perspective, the term we use all the time, liver overacting on spleen, or spleen becomes stagnant, kind of like insult liver. So those are basically the relationship between the two major systems. And Shaoyin being, one thing we need to mention, because a lot of times the people think Shaoyin being is just about kidney yang deficiency, which is not true. Shaoyin being, you have both kidney and heart, and also Shaoyin being, you have the two extreme. One is a cold condition, the other is heat condition. So heat condition is most times due to heart heat. Jueyin being is complex. So you have everything. The organ is the liver, but you could have deficiency, excess, cold, and heat, and everything. So like the last stop of the sixth channel. So that is, if you survive that, that you may start another round. And or if you're unlucky, you didn't survive, that's you're done. And so the sixth channel differentiation versus Zangfu, we pretty much keep that in mind. Zangfu diagnosis is part of so like the 六经辩证, the sixth channel differentiation already include Zangfu, but they're not as detailed. Like in Zangfu, for example, like the current like textbook we study, you have under Zang, you have you have, for example, like heart, right? You have the excess 4-5 pattern of the heart, you have the deficiency, you have the mixed deficiency excess. So you pretty much easily you have like 10 patterns involved. But in Shang Han Lun, it's just not as that detailed, but you kind of like have more like guidance. You already have that part. The 8th principle, one thing I need to point out is, even though in Shang Han Lun you already have, that already covers the 8th principle, but the name of that is from a Qing dynasty doctor by Chen Guozhang, from his book. So it's like the first time, there's a so-called the Bagang 8th principle. So that's, but the content, the idea, the principle, is you go way back to Shang Han Lun. And so Shang Han Lun is also, talking about the passage and the transmutation of disease, how the disease develop, how the disease transport or transform. Basically is that you have a cold, with a cold, if you get treated quick, in time, and you treat it right, that you can stop the progression. Yeah, if you didn't treat it right or you got delayed, there's something else. Yeah. So basically, this part is like, okay, how they from Shang Han Lun perspective, how they look at this. It's like, okay, do you need to treat it ahead of time? Yeah, if certain pattern happens, or will that give you a better prognosis? Yeah, like what's going to happen? Yeah, so will that give you idea? Yeah, it's going to be very difficult to treat because it combine a lot of things. Yeah, so that's basically the passage is about. And there's also one very important message from Shang Han Lun is whether or not they'll pass, they'll transform or transport to next level, to next channel. There's so many factors. One very important, the patient constitution, genetics. So that we know. So what is genetics about? Yeah. So your genes, that your constitution, pretty much determines what's going to happen. Yeah. So like this time around, I read a report with COVID. Yeah. So they say, oh, it's about like 10% of the patient, not 10% of the people, population. So they won't get COVID. Yeah, it's because their genetic makeup of certain things. So that is actually what we call, constitution. Yeah. So you just have, you're lucky, you just have a balanced constitution and you don't do it. You don't get it. But it's not just a pure luck. Yeah. And from TCM perspectives, if you look at through the TCM lenses, we don't have healthy people anyways. Everybody got something, something big or small. It's just a matter of how sick you are, right? And so the constitution can be modified, can be changed. Yeah. So that is a very important concept. Yeah. So you can be like a sick child, but when you do something right, you can still have long, healthy life, or vice versa. Yeah. So that is the idea is like, okay, we're talking about prevention. The prevention is not you just start when they're sick, right? Yeah, you can start from very early, early age, or early stage. And because they have this pattern, they're going to go down this path. If you can do something early on, not always, that should be individualized. It's not always the earlier the better. Yeah, that doesn't always work that way. But that is kind of like the idea. Yeah, and anytime is good. Yeah, you don't kind of like you don't need to wait for a perfect time to do this. Yeah. So this is the point. It's not, you don't wait for that perfect time. Yeah. Anytime you can get started. Yeah. So that's try to cultivate your qi, try to modify your constitution. You can start anytime. Yeah. So that is very, very important. Yeah. That message, you need to deliver to your patient. Yeah. They have a family history, lung cancer, a family history of colon cancer. So when should they get started? Start now. Yeah, right? That is very, very important. Okay, so now we get started with Gui Tang, because Gui Jianglong Gongmu Li Tang is modified from Gui Tang. So everybody knows Gui Tang, know this, right? Yeah, that's and so Gui Tang, two parts. Yeah, part one, to help release Taiyang Bing, Taiyang Zhongfeng. So early stage of Taiyang Bing, there are two types. When the cold, when the heat, not when the heat, when the cold, excess, which is Ma Huang Tang. when called deficiency, which is Gui Tang. So there is like a saying, sometimes you hear or they say Ma Huang Tang is used for like the exterior excess, and Gui Tang is used for the exterior deficiency. So that saying, frankly, is wrong, but it's been around for some time, and that excess versus deficiency only means one thing: sweating, no sweating. So excess, no sweat, Ma Huang Tang. Sweating, partially, slight sweating, deficiency, like exterior deficiency, Gui Tang. That's all. So don't, so sometimes, they kind of like says, oh, they can use Gui Tang for the exterior deficiency. That's not right. All right. Yeah. So you need to know the background, of that. And so in Gui Tang, the second half, besides for exterior, second half is to harmonize the yin and the wei. Yeah. So now comes to like, what is the yin and the wei? What we use in Gui Tang to harmonize the yin and wei. So Gui Zhi plus Bai Shao regulate and harmonize the yin and the wei. Yeah. So Gui Zhi Gan Cao together, pungent plus the sweet, generate yang and qi. So those are the most important principle in Gui Tang. Yeah. So you have two sets. First set is Gui Zhi plus Gan Cao, the pungent plus the sweet that generate yang and qi. And so you may ask, it's like the generating here means you increase the level or you just increase the function? Actually, both. Yeah, both. And the second half, Bai Shao and Gan Cao, the sour and the sweet, produces the yin and the blood. And again, same question, same answer. So you increase the volume or also increase the function of yin and the blood. Yeah, so they both come. Yeah. So in my teaching, I give it a very simple example. What is the Gui Zhi and the Gan Cao? The pungent plus the sweet generate yang and qi. That's cinnamon prism. You want it in the winter time, boost your yang. Sour and sweet is lemonade. Yeah, middle of summer is so hot, you want some, to prevent from having dehydration. You need some lemonade. And we're in Southern California, so we're not normal. So we have both. Yeah, we eat the cinnamon prism with the lemonade. So we're different, but the rest of the world may be different. Yeah. So that is a very, very important principle. And so regulated yin and the wei also can be interpreted. This is from Yellow Emperor's book, right? Yin circulate within the blood vessel. Yeah. And with what? With like blood. Yeah. So yin and the blood both circulate within the blood vessel. And we all know, where is blood from? One theory in TCM is what? The blood is like transformed from the yin energy, nutritive qi. Yeah, so this is the second one, the blood is from bone marrow, from kidney. And so that's how, and the third, the blood is from middle jiao, the qing qi and the gu qi, they transform, they turn into the essence, so the essence is turn into blood. So that's kind of like the three sources, like where the blood is from. So yin and the blood, circulating within the blood vessel. And yang wei qi the detective, not detective, defensive, but detective, which can be a detective force. We're talking about T cell function. So Wei Qi is circulating outside along the blood vessel. So protect and control the movement of the blood vessel. So this is kind of like you look at the yin and the wei. People sometimes ask us like, what is the yin? What is the wei? What do we use that for? This is a part of that. Yin and wei. So yin and wei also, from conventional medicine perspective, sympathetic versus the parasympathetic nerve. One excites the nerve, the fight and flight. The other, is one is active, the other is passive. So kind of like the yin yang thing. And also, more importantly, that vascular disorder we're talking about like in conventional medicine. So when you have an issue with the peripheral vascular issue, and that you need to look at the yin and the wei, and also the peripheral nerves. So that the peripheral, we're talking about the sympathetic nerve versus the parasympathetic nerve. So overall, you look at that. So the yin and the wei can be systematic, right? Not just like limited to one particular organ system. It can be, the whole system. It's yin and the wei. Okay, Donna, let's take a break for 10 minutes. So, Donna, can we take a break?
Sure, Dr. Warren.